Hi everyone, thanks for joining us for another week of Recovery in 20. This week we're joined by Willy. He's the operations manager here at Aspen Ridge Recovery, and we both want to talk about the opioid epidemic. We're going to spend a few minutes playing the blame game and talking about how this problem came about, and then we're going to talk about what Willy's seeing on the ground and some effective treatment solutions for opioids. Thank you for being here.
Thank you for having me.
So we'll start with the origins. I'm sure most of you watching this, if you're watching this broadcast, you probably heard of Purdue Pharmaceuticals and what they've been up to. But there are a couple other issues that I wasn't aware of until I started doing some research for this. We'll start with some shocking statistics. Since 2000, there have been 500,000 opioid overdoses, which is approaching COVID-19 levels of deaths, which I had no idea it was that many. We're already at 500,000. Last year, there were 88,000 overdose deaths compared to 70,000 the year before, so that's about a 20% increase. You can do Google searches for news stories about the effects of COVID and overdose rates. There's some pretty interesting reads out there, sad but definitely interesting. So going back to the beginning, we need to recognize that there were three waves of this epidemic. The first wave began with increased prescribing of opioids in the 1990s, with overdose deaths involving prescription opioids since at least 1999. The second wave began in 2010 with rapid increases of deaths involving heroin. And we are in the third wave right now, which began around 2012, 2013. And that is a significant increase in overdose deaths involving synthetic opioids, particularly those involving illicitly manufactured fentanyl. The market for illicitly manufactured fentanyl continues to change, and it can be found in combination with heroin, counterfeit pills, cocaine. Willy was just telling me that some places on the East Coast that they're lacing even marijuana with fentanyl.
Yeah.
So we'll do a little bit of the blame game now. First being Purdue Pharmaceuticals. There's a huge settlement with the Justice Department recently, billions and billions of dollars that they've been asked to pay around the world. Their name, the Sackler family, is being removed from art institutions. They were big benefactors of the arts. They had a name, a wing in the Louvre in Paris that is now not have their name on it anymore. In the mid-1990s, one of their drugs, MS Cotton, which is morphine sulfate cotton, was about to lose its patent. If you know anything about the pharmaceutical industry, about 20 years, I think it is, when a patent expires, any other company can begin making generic versions of those medications. So most pharmaceutical companies figure out a clever way to remake the drug and extend the patent life for it that way. So they came up with Oxycontin. They used an existing medication, tweaked it a little bit, and the cotton is actually the little plastic piece on the pill that dissolves over time, so it's not one huge dose of the medication at once. They added that to the pill and began a really aggressive marketing campaign. They pushed it to doctors as a cure-all for minor pain, things that they would normally prescribe Tylenol for. They started giving them essentially heroin pills for, assuring the doctors that this was going to be less addictive than morphine, Vicodin, the opiates that they were traditionally prescribing beforehand. They also hired after Oxycontin was approved, they hired the guy who wrote the pamphlet insert at the FDA describing it about a year later and gave him a nice $350,000 a year payment. They actually met with him in a hotel room before it was approved, and Purdue Pharmaceutical representatives and this guy at the Food and Drug Administration sat down and wrote the review together, which, if not illegal, highly unethical.
Very sketchy.
Very, very sketchy.
Yeah.
If you guys want to look up more about Purdue Pharmaceuticals, you guys can do a Google search. Last night, HBO aired a fantastic part one of their documentary, The Crime of the Century. If you have HBO Max, I highly recommend you watch it. It was a great, great program. Part two is on tonight. And we'd be remiss if we didn't talk about doctors. They do overprescribe opioids, like they overprescribe antibiotics, but generally it's well-meaning. They don't want patients to experience pain. But when they prescribe 30 to 60 pills when 5 or 20 would have been plenty, that's where you get a problem. And they do that because they're used to prescribing in multiples of 30 days a month for a supply of a once a day medication. If they were to prescribe, say, 6 or 10 pills, they're going to get a call from the pharmacist asking them for a nice round number because it messes with their inventory controls, and they'll have extra pills if it's an odd number, which I had no idea that was even part of it. And that's going to take up a lot of the doctor's time. So they're just going to write 15, 30, 60-day supplies. It's those leftover pills that become the problem. If someone, a teenager comes over, looks in the medicine cabinet, teenagers are curious about substances. I know I used to scan people's medicine cabinets as a teenager looking for something fun. That's where the problem comes, the extra pills. There's one other factor I just want to touch on briefly, and that is the Center for Medicare and Medicaid Services and some hospital administrators. So as currently structured, hospitals are scored based on their performance and measures of processes of care, outcomes of care, efficiency, and the patient experience. The patient experience portion of this is based on scoring surveys that are sent to the patients, which actually includes scoring of their satisfaction with pain control. This portion of the overall survey is weighted 30%. So the Medicare and Medicaid reimbursement rates are directly tied to the outcomes of these surveys. So they're incentivized to overprescribe opioids to people to get a higher score on these patient satisfaction surveys, or they're going to get much lower reimbursement rates from Medicare and Medicaid. I thought that was a pretty interesting part that I was unaware of as well. Well, now that we've played the blame game a little bit, and we've got a couple culprits for the opioid epidemic, I want to talk about what's happening now. Willy sees firsthand what's happening on the ground at Aspen Ridge. So, how do people become addicted to heroin? When I was in treatment, we were talking about this before. There's about 40 guys. I think there were 4 or 5 of us that were old school alcoholics. Everybody else, without exception, was in there for heroin. And they all had one of 2 stories. They got an injury. Doctor prescribed opioids for too long, too many pills, and they got addicted to it. And they were starting to buy, when the withdrawals kicked in, they started to buy them on the street. That got too expensive, and they had to switch to heroin. The other story was they found some of those extra pills in mom, dad, grandma's, neighbor's medicine cabinet, being curious, took a couple of them, liked them, started buying them, and then eventually turned to heroin when it became far too expensive to buy 50 pills at $50 a pop on a regular basis. So what are you seeing around here? What are you seeing out in the world? Are there other stories that I'm missing?
Not in my experience. It's been exactly that. To kind of get a little bit ahead, I've never seen someone whose story is, oh, I just started with heroin. It always starts with, like you said, like whether it be just like a minimal surgery, like wisdom teeth, and even just getting the lowest amount prescribed to you that you can. That always seems to set off the motion for those who end up in our care.
No one starts with heroin? You've never heard? Not a single person?
Never heard that. No.
I can't say I have either.
Yeah.
So it's all starting with these prescriptions. Is it harder to get these prescriptions these days?
Yeah, I would definitely say so. With a mixture of just like, I mean, you listed off all those statistics, and obviously doctors are well aware. The one thing that I would say doctors are still pretty kind of prescribing fairly often would be like Suboxone, which it's still with that kind of good intent underneath, where it's hopefully helping them get off of heroin.
Do those get you high?
Yes, they absolutely can. So that's where there's still the issue, right? The person is still physically dependent upon an opioid. But yeah, getting any type of like Oxycontin, like from back in the late 90s, early 2000s, that is very hard to do nowadays. Really, if anything that is real and not counterfeit, it's coming from an elderly person who just
Pain
had their
management.
medication stolen from them. Yeah.
How much does your average pill cost on the street?
Really, anywhere from like $30 up. $30 really being the cheapest.
I'm assuming a lower
Yeah,
dose.
for about the lowest dose that you can get. That would be worth it for someone who is already addicted to the point where they're willing to turn to the streets. But especially now with prescriptions being so much harder to come by, those prices are being reflected in the black market.
So let's say someone gets addicted through one of those two scenarios. They've turned to the street. How many of those pills do they need to not be in withdrawal? Like, how much do they have to spend a day to maintain?
Yeah, and that it's very individualized. I would say a good, probably low-balling average would be about $100 a day in order just to stay well. So it's an expensive habit.
So I imagine, it's pretty easy to consider other options.
Oh, yeah.
And then turn to heroin. So if you're spending let's say $100 a day on Oxycontins on the street, how much would you spend? What's the heroin equivalent? How much does that cost?
So I mean, the I guess the selling point for me when I made that switch was with that same 100, I can get something that is going to last me longer and get me higher. And that was the big selling point for me. So it didn't necessarily, at least right away, increase how much money I was spending. But what it did increase was my tolerance, which down the road increased how much money I was spending.
So it starts off like a nice cheap alternative, and then are you ever back up to about what the pills cost, or is it still a little cheaper?
Yeah, no, absolutely. And fairly quickly too, you know. Especially once the opiates have you in its grip, you are following wherever that path takes you.
It's just crazy.
Yeah.
So what's happening around here? Of clients that you see who are addicted to opioids, what's the breakdown men to women? When I think addiction, I think, oh, it's probably like 75% men. I know that's not the case, but that's where my brain just assumes. Is this more of a guy thing, a lady thing? Is it down the middle?
So that's where it is tough, because like you come into treatment centers and you will see it reflected where there's always a higher population of men. But in my experience of like being out on the street and being a part of that lifestyle, it is a bit more split down the middle, and I don't know why women are, whether it be more hesitant or just don't have the resources to make it to treatment as the counterpart of men.
But on the streets, fairly.
Yeah.
I'd say anecdotally, the people I know that are recovering from heroin, it's probably about
Exactly.
50-50.
And even in like 12-step fellowships, there's closer to a healthy balance, you know. But for some reason in treatment, I've never seen as close of a balance as I have in like real life.
That's interesting.
Yeah.
I'd be curious to anyone out there as a scientist. We'd be curious to see some access numbers about treatment and opioids. So what gets them in the door? What's the rock bottom?
So, I mean, everyone's rock bottom, at least externally, can look a bit different. But in my experience, internally, it's always the same type of feelings. It's just getting to the point where there's no purpose in life anymore except to use this substance that is slowly killing us. Externally, all possessions could be lost. Myself and other people have ended up homeless. And part of my story, I was in and out of jail. you know. But that's what kind of that's how my journey in recovery successfully started, was that initial getting removed from the drug long enough, and that was jail for me.
You had to detox in there?
Yeah.
Was that fun?
That was the worst experience probably of my life. 24-hour lockdown. They would not let me out to shower, so I was stuck in a cell by myself for about 5 days.
Oof.
Yeah.
That sounds pretty rough.
Yeah.
Does someone need a medical detox from an opioid?
I would absolutely always suggest it. For me, in my experience, if I had my detox kind of almost any softer, more comfortable, I don't know if I would have been granted that gift of desperation that I had. But I would never wish that on my worst enemy. I'd absolutely always suggest someone going to detox, getting access to those kind of comfort medications that psychiatrists and detox centers can provide for you.
What are those comfort medications?
Things like Clonidine. I know gabapentin's a big one. Stuff to just kind of help with like the restless legs, the lack of sleep, the cold sweats, the stuff that makes it really uncomfortable to just sit in your own skin, because that is the hardest part when you're going through those withdrawals.
To not just.
Yeah.
It sounds absolutely brutal.
Yeah.
How long does a detox typically take on average?
So for heroin, for me, until I like stopped really experiencing all the withdrawal symptoms, it was about a week and a half. But then coming from like if I were to have used medically assisted treatment, that withdrawal kind of time period is a lot longer and a lot worse. That can take anywhere from up to a month, even a little bit longer than that.
That sounds pretty brutal.
Yeah.
So we were talking about fentanyl. Is the withdrawal from I guess I should ask, does anybody just use fentanyl, or is it a mix of heroin and fentanyl that they're buying on the streets?
So that's something that was newer to me, was having clients that were just fentanyl users. And I mean, that's surprising because you just hear the statistics of how many people are overdosing and how little it takes to overdose from that. But that is absolutely a thing now, and like you were reading in the information before, it's cut with everything, and it is so much stronger, so it's almost the same concept, you know, where people are getting higher for about the same amount of money. Why not just move to that?
Does the mixing process with fentanyl, from the perspective of someone selling it, a drug dealer, is it more profitable to add some fentanyl to the mix and kind of spread it out and cut it? Like, what's the rationale for putting fentanyl in somebody's heroin and not telling them it's in there?
So absolutely that. Stretching it is always a motivator for a dealer. But also there's this strange logic that I've only really found in heroin addicts, where if they hear of a batch that people are overdosing from, their first thought is, I should stay away from that. It's, that sounds like it's really good stuff. And that's what attracts heroin addicts that are still actively using to the stuff that will probably kill them.
Oof. So someone comes in, they've gone through Hell Week, they're detoxed, or 10 days, whatever it is for their specific situation. What's the next step? What do they do next?
Next step, I would always suggest treatment. Again, something that I've seen that's really across the board is there's always a underlying like theme of some sort of mental health or trauma that in conjunction with learning how to live sober is how you have the best chance at being successful in recovery.
Treatment for as long as possible.
Yep.
Seek some mental health
Yep.
support. So you definitely want to look for a treatment center where it's therapy heavy
Yep.
rather than 30 days locked down on the beach and then you go back to wherever you were before.
Yep.
So let's say they're 90 days sober, they're discharging from whatever program they're in. What do you think are the most important things that person needs to do to be able to maintain their recovery?
So that's something that preemptively we do here in our program is kind of a system with what I see as the three most important things. And that would be getting very ingrained in the recovery community of wherever that person is at treatment. Here we're very blessed to have a strong recovery community in Lakewood and Denver. So something we do weekly is we'll bring the clients to whether it be 12-step meetings, SMART recovery meetings, whatever it is that they align with most, and start to get them to like create their own fellowship, reach out to people, go on coffee dates with these people, and then a level of commitment to their recovery by being of service to whatever fellowship they align with the most. And then working whatever program it is and living by it. So those would be really the three big things. And if you're familiar with the triangle, you know, it's really that unity, service, recovery. You know, those are the biggest three things that I would suggest to every person early in recovery from opiates to go out and do. And that's kind of across the board with addiction or alcoholism. You know, it may be a different substance, but it's the same disease. So
You made the point I was just going to make that I've seen it as a member of one of the 12-step groups, that the one I'm in, there can be a little bit of shaming to people who use heroin, who use opioids, to use what are, I guess, generally considered the dirtier, the lower class drugs. And it's all the same thing. It's exactly the same thing. That's the advice I would give to an alcoholic. Everything you just said. It's just addiction. It's the same addiction pathways in your brain that get activated, pleasure reward system, from any mood altering chemical. So I think our community could definitely do a little bit more bridge building and a little more understanding. I know there can be some tension between the 12-step groups sometimes. And I think one of the things we preach about all the time is ego and open-mindedness, and I think all of us could probably take those a little bit more to heart.
Yeah, absolutely. And I mean, the big solution in almost any pathway of recovery that you'll take is just finding some sort of spirituality and living your life along spiritual principles, and shaming or shunning people because of their drug of choice or their substance that they were addicted to doesn't align with spiritual principles in and of itself. You know, at the end of the day, one of the biggest contributors to my recovery and my sobriety is the fact that I have the opportunity to help people today. You know, and I know you've heard the cliche before, like, look for the similarities, not the differences. So it truly is that.
It's just addiction. They're all pretty much the same. And Willy talked about spirituality. You can go back and look at the first episode we did. I sat down with our clinical director to talk about spirituality. I'm a hardcore atheist and she's a Christian, so we both talked about it from different perspectives. It doesn't mean what you might think it does, so give it a look. It's a pretty interesting conversation. Well, thanks for joining us, taking time out of your busy day. This was enlightening to do some of this research. I knew, broad overviews, but actually digging in, it was quite shocking. I've got no stock in HBO, but I highly recommend watching that documentary series, The Crime of the Century. It's on tonight. Check it out on your HBO Max. And I want to thank you guys for watching. Be sure to join us next week for our next episode. And if you know anyone that needs help with addiction, mental health, or trauma, you can visit AspenRidgeRecovery.com or give us a call at 855-281-5588. We're available to answer the phones anytime, and we accept all major insurance. So thanks again for watching. We'll see you next week.